It's your favorite therapist from the town, Shell Best, and I'm here to discuss Dr. Cheyenne Bryant's recent comments on licensure as a therapist. Now, Dr. Cheyenne Bryant is a therapist who I believe is from Southern California. I'm not sure, so I don't want to stamp that, but I believe she's from Southern California. Why do I say that? Because she graduated from Cal State Northridge. Shout out to everybody who went to Northridge. But yeah, she graduated from Cal State Northridge and with her master's in MFT, marriage and family therapist. So before I even get too far into it, I'm really gonna play the clip. She recently went on to Joe Budden's. She said some statements ended up being real controversial. She basically said that she doesn't operate as a therapist under licensure because she feels like it limits her, right? And she feels like, she doesn't gain from going the whole role that, I shouldn't say role, but going the same road that other therapists go, right? For most of us, we all had to go through a strenuous process. We had to go through a lot of work. We had to go through testing. We had to go through internship. We had to get hours. We had to get supervision while we're getting our hours. People have to listen to your sessions and, watch your notes. And it's a real strenuous process. So she's saying basically that she doesn't necessarily believe in it. So we're going to check it out. I'm going to respond to it. So yeah, let's check it out.
No longer practice under a license.
And why
right now I'm in private practice, I'm saying. And that's what people don't understand, right? So just to educate some folks a little bit, a license is really only needed so you can bill insurance. Majority of people who know that in order to bill insurance as a therapist or a physician or a psychologist, psychiatrist, you have to diagnose. So what do they rather do? Pay out of pocket.
That's what
and so when I realized that, I thought, well, okay, it may create a gap within our community, our black community, who can't afford health care or afford mental health services.
So I wanted to jump in real quick right here because Dr. Cheyenne Bryant, one thing I love about Dr. Cheyenne Bryant is she hella articulate. I love the way that she just captivate her audience and the way she grabbed the attention of everybody in the room. You feel me? Shout out to Dr. Cheyenne Bryant for real. But, I'm a fan of Dr. Cheyenne Bryant. And before I, get into, the pieces that I, kind of was questioning, I'm a fan of Dr. Cheyenne Bryant and what she got going on. And just because, sometimes I'm an opinionated person personally. So just because, my opinions may or may not always align with someone doesn't mean I'm not a fan of them. So, I'm definitely a fan of what the sister got going. However, her saying that licensure is just for insurance, I didn't understand that, to be honest with you. To me, and I can name a lot of different reasons, and this is just me going off the top of my brain. I don't got nothing kind of, pre-planned, but I know one thing about being licensed is that it holds you to a certain ethical standard. You know what I mean? This is why, you have people who, as for psychiatrists who hand out medication, but you have people who, back in the day used to do experiments on their patients, like Tuskegee, right? Having a board prevents that, right? It prevents people from, doing unethical things with their patients, right? So I don't know. I don't think anything's wrong with that. And number two, I know also getting licensed and having to get licensed by the board, it makes you an effective therapist. You got to go through so much strenuous training, so many hours, you got to go through the test. By the time you're done with that process, you really have bettered yourself as a therapist, to be honest with you. There's no way around it. So for me, I don't see the negative to that. And also, I don't think that it's limited to just billing for insurance. To me, that has nothing to do with getting licensed, And if I'm really being honest, when you're young in your career, a big piece of you wanting to get licensed is that you want to get the jobs, as a therapist, and all the jobs required at your license. So for me, I think that, if anything, I think for me, that's the big piece. Is that there's so many different aspects to licensure beyond just that of billing insurance. Like what? I was trying to get licensed so I can get the best, therapist job that I can get, where I can get the best training as I was still young in my career, for real. So if you're trying to get a job, these days, back in the day, my mom's an MSW. Back in the day, you can get all kinds of jobs in mental health field, medical social work without licensure. But today, those same jobs require you to have, an LCSW. So, I don't think it has anything to do with insurance. It's more so about, like I said, really wanting to be employed. But beyond that, wanting to, be an effective therapist and be good at your job. And one thing I can say for sure is anybody who's went through that process, there's a certain minimum skill set that you have just from having went through that process of getting licensed, Something else she said is that people don't want to get diagnosed. I've served thousands of people, like from the trenches from LA to Oakland I have not come across a lot of people who don't want to get diagnosed, to be honest with you. I think if you have the ability to talk with people and explain, the process to people, and they understand that, this is going to help them in better understanding themselves and going to help them in better being able to reduce their symptoms, right, and cope. I don't come across a lot of people who don't want that information. A lot of the times, if anything, people come to you because they want that diagnosis. Hey, do I have ADHD? Is this anxiety? Is this depression? My partner told me I got something called PTSD. Is this PTSD? So a lot of times I'm coming across a lot of that in our population rather than people who don't want to get diagnosed. So to not only say that, like, our people don't want to get diagnosed, but then to say that on top our people don't want to get diagnosed, but that's causing people to go private. I do private, I have a private practice as well. I don't get a lot of referrals because from people who don't want to get diagnosed, to be honest with you, So for me, I think that I got what she was trying to say, but I don't know. I had to question what she did say, though, to be honest with you. And furthermore, she said that, it creates a gap because our people don't want to get diagnosed, so they're going private. And then she's saying some people can't afford private, so she's stepping in that gap. But then I'm like, that didn't all the way make sense, because I know she's good at what she does. I peeped her. So I know she's real good at what she does, and she probably charges a good amount. So I'm like, I'm sure she's not stepping in that gap, because that would insinuate that, like, basically she giving away her services for the low. And I'm pretty sure to get a session in with Dr. Cheyenne Bryant, you not getting it for the low. You feel me? So yeah, I don't know. I had those questions. I'm sure if I was with her in person, I'd be able to have a more in-depth conversation in a way where I probably have a better understanding of what she was saying. But anyway, let's jump into this next clip.
It also is a way that, as a therapist, two things: you can obviously make what you deserve, because therapy is real. We're giving everything we have in there, and we're unpacking shit, and we're helping you process through things. So it's not us sitting there, well, if you're an effective therapist, saying, tell me more. You should be unpacking, and you should be able to take somebody and drive with them to their goal and give them.
So she said that by not being licensed, it gave her the ability to make more money. I ain't really all the way get that, because how does not being licensed, most of us, 99.9% of us got licensed to be able to make money. So I'm trying to understand, how does that allow you to make more money by being unlicensed? I ain't get that piece, and maybe I'm tripping. And she doing her thing. She at a level where maybe she knows something that I'm not aware of, but I didn't really understand that, because I don't see how that applies to just the everyday, regular, therapist such as myself. Maybe a celebrity, life coach, like her, but for a regular everyday therapist, I don't see how being unlicensed would it gives you the ability to make more money, to be honest with you. I was trying to understand that piece. Something I did want to point out, though, is that the Queen said, when referencing therapists, she said we, and then she said, we doing a lot in these sessions. We, helping people drive it home. And then she said, well, a person, if they're effective, should be able to help someone drive it home. I just want to point out that, and I'm a fan of her. for a while now, and a lot of her content, she definitely includes herself in a therapist conversation, and speaks of herself in first person as a therapist. So I think that's where a lot of what we're seeing now is coming, a lot of the blowback, because people are like, well, are you really a therapist if you're not licensed? And you're not a psychologist? Then, I guess people are saying that, well, hold on, what makes you a therapist then? So I don't know. It's going kind of far in terms of, I feel like, at least in terms of how hard they're going in on her. But it is valid nonetheless, though, because she does at times refer to herself as a therapist, and then at other times she'll be like, nah, I'm not a therapist, I'm a life coach, So I want to jump into this last clip, and then, I'll actually show her saying that.
Anyways, when I realized that, I thought, well, one, I'll just be out of pocket. Two, when I tell my clients the truth, is that in order to bill insurance, I have to diagnose you. And you only get about 6 weeks. Mm-hmm. In order for me to get 6 more weeks approval, guess what? And so I'm not saying that folks should, not go get therapy if they have to bill insurance. Get the help that you need. I advocate for that. I advocate for therapy being a lifestyle, not just a intervention, right? It should be a preventative measure. But I am saying that for me, I'm in private practice. I make much more money. It allows me to have more leverage and really be hands-on with my clients. I'm not binded by BBS, the Behavior Board Science rules and regulations and ethics, and so it just opened up a whole nother floor in industry for me.
She said that you only get 6 weeks with the insurance companies, and I was trying to understand that too. So she said, if she's billing an insurance company, like if I'm billing Anthem, Blue Cross, or Blue Shield, someone only gets 6 weeks of therapy and then I have to renew it? I haven't had that experience. I just do 5 sessions with somebody, I send in the billing, do another 5, send in the billing, do another 5, send in the billing. Or you can send in the billing every session, or you can send in the billing every 2 sessions, or however many sessions you want to send in the billing. But it's not a renewal process. You just bill when you bill. So I didn't understand that all the way, to be honest with you. I was definitely trying to get a better understanding of that. Also, she said that she's not telling people, hey, don't get therapy if you have to get diagnosed. She's like, nah, that's not my message. But like, it almost comes across a little bit like that's almost being encouraged through this conversation a little bit. And maybe I'm just seeing it like that because this is not something I'm super familiar with. Yeah, I know some black folks like, man, I don't want, no diagnosis on my record or something like that. Yeah, of course, some people. But the vast majority, I don't think so. That hasn't been my experience, to be honest. So I think through this conversation, it can, in ways, be encouraged for people to not get therapy, which is like counter to really what we're trying to do as like mental health advocates, So I understand why so many mental health advocates are getting so enraged online. And I also understand Dr. Cheyenne Bryant's point. I think she just banging for her, to be honest with you. She at where she at. She said she make good money doing what she do, and shout out to her. Honestly, I don't even think that even has to be stated, to be honest with you. Like, it's one of those things where it's like, somebody who, I'm using slang here, but when they say somebody who real, don't got to say they real. It's one of those things where it's like, we can see her shining. I see her shining. You know what I mean? I've been seeing her shining, and I love to see it, to be honest with you, So for me, it's like, you ain't even got to state it. You just keep shining on them, sis. You feel me? You stating it make people question, like, what's the correlation between being licensed and getting your bread? You know what I'm saying? And I don't know that I see a correlation, to be honest with you. You just doing you, and you doing you in the best way. And salute to you, for being able to do that. And for me, like I said, I believe the BBS makes therapists more effective. I believe a therapist, after getting 2 years, matter of fact, let me speak for myself, man. In my 2 years of training, I learned more than I've learned in 5 years and 10 years of being a therapist. Like, I learned CBT. I learned ACT. And I'm sorry, I'm naming these are modalities of therapy. These are different types of therapy. So I learned cognitive behavioral therapy. I learned acceptance commitment therapy. I learned dialectical behavioral therapy. I learned seeking safety. Shout out Sandy. I love me some Sandy, but Sandy McClellan, that's who trained me, and I took so much from those years in becoming a therapist. It just made me so much more effective and good at what I do. I can't even imagine doing what I do without my 2 years of training, really, before and during the licensure process. I'm talking internship and licensure process, like for real. Because Sandy trained me during my internship. That was before I even started the licensure process. But those two put together, that's what made me a therapist for real. And I just can't imagine, the type of therapist I'd be without that, just to keep it all the way. So I don't think the BBS limits anybody in a bad way, in my mind. But if you can do what you're doing without the BBS, salute to you. I'm not knocking it. For sure not. So here she said, and everybody coming at her, there's thousands of people coming at her. I understand. At a certain point, she deserves a clap back or two, okay? But here she said, I'm the most sought out psychology expert, life coach in the world, sweetie. I don't need a license for that. And again, it's just like, you could pop it. It's a free world. You can do whatever you want to at the end of the day. As long as you're ready, I guess, for what comes with that. Because when you pop it like that, you almost make people feel like, it's like people always root for the underdog, right? And then when you get on top, people, want to drag you down, right? Some people say it's the law of gravity or the law of physiology or physics, rather. I don't know. But I feel like it doesn't hurt to be humble. It doesn't, like, again, sister, you doing your thing, and like, salute to you. I don't know, I'm a fan of you, but you just want to don't let people get you to a place where you giving them back, you know what I'm saying, what they giving you, and then all they giving you is negative energy. You know what I'm saying? You got to be careful, But with that being said, I just want to point out here that, like, it's a shift here, because now she like, hey, I'm a psychology expert, I'm a life coach, but in a lot of her interviews, she said, she's referencing herself as a therapist, or even in Joe Budden interview, she said, us therapists, we as therapists. So I think it's a little bit of a shift now, when she's saying, all right, I'm not going to kind of call myself a therapist, rather I'm going to kind of go in this lane of life coach, psychology expert, In reality, she had MFT. She can just go get her licensure and just be like, hey, I'm licensed now. What you going to do? But again, she don't need to do that. She probably has a private clientele built up to a point where she don't need to, I understand. So the brother, Dr. Umar, who I believe is a black school psychologist, I don't know if he's actively practicing, but I know that's what his credentials are. And I know him to be a Pan-Africanist in the community, so that's why I respect the brother a lot. But he's here standing up for the sister, and I like that. That's noble of him, you know what I'm saying? Because she here getting attacked a whole lot, so I can understand him saying, hey. So let me read out here what he did say. He said, please leave that sister alone. It's true, when licensed, you're under much more professional scrutiny, which can lead to you becoming unlicensed if the board finds fault with your methods and opinions. If you go against the system, you can be stripped of your credentials. Remember, Dr. Phil wasn't licensed, so the board couldn't punish him in any way. It's the reason I've never applied for my license. I do most of my work as a certified school psychologist anyhow. But nonetheless, they could try and take my license solely because of my views on ADHD. And he put absent dad from home disorder. So the first point that I want to respond to here, just off the dribble, is I'm not saying that we, as a black man in our society, I feel like anything's a possibility in terms of ways for them to try to systematically oppress us. With that being said, I've just never heard of somebody having their license stripped because of them having radical views. I have radical views, and I have radical views on ADHD. With that being said, I've never heard of somebody having their license stripped because of their views rather than their practice, right? Like, let's say, no, they've never harmed a client. They're doing great work and their license gets stripped because they had a radical view on medication or on ADHD or something of that nature. I'm just not familiar with a case like that, so I don't want to say it can't happen. But, yeah, to say that, the reason she's not getting licensed is because she is worried about saying something where they can then double back and take her license from her. Well, she's not really tripping off the license in the first place. So I don't really think that's an issue for people who are not tripping off it in the first place, right? Second, he referenced that's why Dr. Phil didn't have his license. Well, Dr. Phil was more like a reality TV psychiatrist. So, yeah, he did reality TV for a living. I'm sure he did some real psychiatry on the side, probably with a few celebrities. But with that being said, yeah, he probably had enough private clientele to where he didn't need it, similar to her, And if that's your reality, then salute. I just think that it's okay to say that you made it to a point where you have enough private clientele to where you don't need necessarily to seek out jobs where, they're asking for certain credentials. You don't need that anymore. It's okay to say that and not put 99.9% of therapists down by saying most of us who are going about it that way, which in reality is nothing wrong with it. It's the right way to go. I wouldn't tell somebody to go get a unlicensed doctor to go get surgery, or an unlicensed surgeon, you know what I'm saying? Or an unlicensed lawyer, you know what I mean? So with that being said, or unlicensed barber, but with that being said, yeah, salute to anybody who, doesn't have to go about it that way. And for us who are going about it the right way, I think there's a lot to be said for that. Here, Dr. Cheyenne Bryant said, I don't need a license because I'm not a therapist. I'm a psychology expert and a life coach. I don't understand what's so hard for people to grasp about that. Coaches do not need a license. I do not identify as a therapist. My bio does not say therapist. My website does not say therapist anywhere on it. It clearly says psychology expert and life coach. And if that's the lane that she's driving in, there's nothing wrong with it. I just think people get confused because there's been different content where she's referenced herself as a therapist. She said, us therapists, or we, when we therapists, and things of that nature. So I think people get a little rightfully confused. To be honest with you, I thought she was a therapist. I didn't know that she identified as a life coach. And I'm a big fan of her until this whole controversy came up. So yeah, if that's the lane that she's driving in, then it doesn't even really matter then what us therapists do in terms of getting licensed, right? That defeats the whole purpose of the conversation to me, because if you're a life coach, then you're just a life coach, right? But in terms of being like, or licensure limits you, or licensure does this, or licensure does that, or I don't even see the purpose of the conversation if that's not the lane that you're even trying to drive in, If you're just simply trying to be a life coach, then a psychology expert, and you have enough private clientele to do so, again, I don't think there's anything wrong with that. She has a new book that she just released, so she's doing a media run right now, and I'm like, well, maybe she's trying to kick up dust for a reason. That might be smart. But this right here is a clip off of her recent Breakfast Club interview where she is explaining the whole situation around her credentials, and, everybody's coming at her now for her credentials. I'll let her explain, and I'll give a little commentary on it.
Doctorate, because people can't find your dissertation online.
Mm-hmm.
How are you responding to that in this new era of your life?
I'm going to clear it up once on here. Mm-hmm. I'm not doing it again. And I'm clearing it up for my doc squad, for my fan base, for my audience who deserve to hear me address it. For the folks who have already made up their mind to not like me or not understand me, listen, I don't give a fuck what your narrative is. I would like for you to recreate it, double down on it, and run that shit, because I don't give a fuck about it. Now, to my doc squad, my fan base, my folks, my village, it's very simple. I went to a school, Argos University, completed an entire program. I went back online to get my official transcripts, because I was applying to a law school many years ago to be a professor there. And I had to provide my transcripts, right, to get hired. And I went to contact the school and say, hey, I need my official transcripts. I need my entire thing. And there was no school. I was like, okay, I'm confused. I Google. It says this school has been shut down. I said, oh, well, they got to have records. I mean, they were accredited when I attended the school. They were accredited when I finished the program. I go and look, there is a third party that has the records. Where I contact the third party, that third party only holds records for 2 years. I was past my 2 years. So that means that I had no access to records. And then I contacted, financial aid. You can't make up financial aid. It shows that I paid for a doctoral program alongside my master's program and my undergrad program. And they said, we can fully refund you your money under one circumstance. We give you your money back. You don't get credit for not a class, a course, a program you took in this university, at this institute. So do you want us to refund you? Or do you want us not? I said no, because I didn't want to risk the chance of them saying, well, we're going to give you back your money, and it wipes out your entire program. Luckily, I had, I do this with all of the schools. I had downloaded from the actual student portal my transcripts at that time. And I was able to get just about all of my transcripts, including up to like dissertation. But everything else, there's just no holding take for any of our records, which I think is completely effed up. Just in general.
They are going to kill you online this week. They're going to say she has no records. They just want to hate you regardless.
No, that's fine. And it's not even that there's no records that I don't. The school had a third party that carried the records only for a limit of 2 years. So it's not me. It's any student that attended Argosy. But again, it doesn't, how can I say it? It doesn't affect me, because if I chose to go get a license as an LMFT, I have my master's in marriage, family, child therapist. I have my hours. I can just take that and say, hey, let me submit these for licensure, and I want to go sit for my exam, and all I have to do is study. I don't need a doctorate in counseling psychology to go get licensed as a therapist. That's what we're all missing.
So now a lot of people have been attacking Dr. Bryant, and I don't necessarily agree with that. Like I keep saying throughout the video, I'm a fan of her, so I don't necessarily agree with attacking her. I just think that it gives us opportunity to have a conversation, particularly at this time as we are continuing to introduce mental health more and more into our community as Black folks, and just urban inner city in general. I think that this gives us the opportunity to have these conversations in terms of what does licensure mean to us. There's different processes that are still woven within a system that we don't trust, and I get that. However, at the same hand, we don't necessarily have alternatives where people can access good care safely. So I don't know about promoting, not going about doing things in a way that most people do in terms of getting licensed to become a therapist. So with that being said, I don't think the sister deserves all this, that like people attacking her, then people attacking her credentials. It don't even make sense to attack her credentials. She an MFT. I know a lot of people don't understand that. So when you're a therapist, you're either an MFT, a marriage and family therapist, you're an LCSW, a licensed clinical social worker, like your boy, or you a psychologist, right? She's an MFT, right? Now, if you want to keep going on to school for another 4 years after you get your grad degree, and most people do that if they want to go into like research or they want to be a professor, then you could become a psychologist, But most people were therapists or MFTs, LCSWs, and now they got this whole LPC, LPCC thing going. But historically, it's been MFTs, LCSWs. She's an MFT, so she for sure got the credentials to be a therapist, for sure. So I don't even see the point in attacking her. And then everybody like, oh, well, she don't got her doctorate, but she going by doctor. I don't know if she got a doctorate or not. She said Argosy shut down. That's the university that she went to. And she said her dissertation is nowhere to be found because the university shut down, and that because of that, she can't even get access to her transcripts or her degree. I don't like. Is that the truth? To be honest with you, I don't know. But to me, it don't even like. I'm not gonna say it don't matter. That's going too far. But I'm not going as so far as to question somebody on what they're telling us. Their truth is, if she says she got her doctorate, then she has her doctorate. It's not even important to me because she has her MFT, so she's already a therapist, like off the dribble. So anyway, this is her explaining the whole situation on The Breakfast Club. And yeah, I just felt like, let's give a sister a little grace. Let's give her some room. And I hope this is just an experience that she learned from. You feel me? But yeah, appreciate you for watching this. Let me know what you think in the comments. I'm out.